Hi everyone, this is Dr. Rajini, Gynecologist, Laparoscopic Surgeon from Care Hospital, Banjara Hills. Now we are going to talk about gestational diabetes mellitus. What is gestational diabetes mellitus? It is diabetes which is detected first time during pregnancy. So we see a lot of women who were non-diabetic prior to pregnancy, they suddenly become diabetic during pregnancy. So why does this happen? So in pregnancy what happens is placenta, which is the barrier which carries the nutrients to the baby. So that placenta also produces certain types of hormones. So few of the hormones, they act on this insulin and make it unavailable, and they cause a situation called insulin resistance where insulin cannot act and it leads to high glucose levels in the blood. So glucose, in spite of getting absorbed into the cells, it gets freely circulating in the blood, so it leads to high blood sugar levels. So it usually happens up after 20 to 24 weeks. So what happens with this increased glucose levels? When these increased glucose levels are there, it leads to a lot of metabolic disturbances in the baby. Baby may become big, large for gestational age baby. Because of this overweight, the mother can land into cesarean section, preterm deliveries, and because of even the sugars are not detected, and if the sugar levels becomes very high, it may cause sudden intrauterine fetal death also. So whenever you are going for a regular antenatal checkup, in the first visit itself, get your sugars tested. So when your sugar levels are normal, then it is a normal pregnancy. But if your sugar levels are high, definitely there are a lot of options and treatments available to treat such pregnancies. Whenever your sugar levels are raised, your gynae may advise you a dietary modification therapy when your sugar levels are under control. Sometimes you may need medical management in the terms of tablets, or if your sugar levels are very high, uncontrollable, then you may have to go for insulin injections also. So this gestational diabetes comes in high risk pregnancy category. So you should be under close monitoring with your gynecologist. Your sugar levels need to be checked every day. With a lot of care, all this diet management and whatever medical management which is given to you, you can go for a successful pregnancy. See, even after the delivery, sometimes what happens is the babies can go into hypoglycemia because of mother's sugar levels. Sometimes the baby metabolic disturbances can also come in the babies, like hypocalcemia and hypomagnesemia. These babies which are born to diabetic mothers may later be prone to obesity in their future also. So all of you get a preconception counseling done even before planning pregnancy. Get a gynecologist checkup done and get your sugar levels checked. If your sugar levels are high, so get a proper appropriate treatment, get your sugar levels under control, then only plan pregnancy to have a good successful pregnancy. Thank you.